One of our favorite times of the week. We love it during football season. The Pat and Aaron Injury Report presented by Florida Orthopedic Institute in partnership with Tampa General Hospital. And
Aaron just told me he even likes it better than Sundays, actually watching the games.
Well, listen, I didn't say that because, listen, I wouldn't lie to you people. And anyone knowing me and Dr. Kumar, who's joining us now, will know it's all about the games. It's all about the football. And that's what we're here to do. We're here to talk about the football. Dr. Kumar, how you doing? He's coming right out of surgery, I bet. Are you doing surgery right now?
No, that would be crazy.
We like crazy on this show. All right, let's start with this, Dr. Kumar. Christian McCaffrey, he suffered the PCL injury. They've been having a lot of injury issues in San Francisco. We've heard MCLs, we've heard ACLs. I don't really hear a lot about the PCL. What's the PCL?
Yeah, so it actually sits right next to the ACL. It kind of makes a little X in the middle of the knee, and important for stability. They're a lot less common, obviously, than ACL injuries, but, they can be serious injuries just like ACLs. They put a 6-week or so timeline on him, so hopefully this is just a partial or a sprain or something not serious that requires any surgery.
He's been getting injured a lot the last couple years, and he just seems to be kind of slowing down, and we know how quickly a running back's career can kind of go right off the edge. Do you think he's ever going to be back to the Christian McCaffrey that everyone was taking first overall in fantasy drafts, or is he going to be on the decline now just because of his physical issues?
Yeah, that's always the concern, right? His age, he had a ton of touches over the last couple years. He's got Achilles and calf and now a knee, and just for the running back position, we know sometimes that explosion and that top end speed kind of fall off pretty quick. Obviously we all hope that's not the case. He comes back healthy, whether it's this year or next year, and he's the same old guy. I picked him number 1 overall too, so I'm in the same boat as everybody else, hoping he comes back happy and healthy.
Dexter Lawrence, his season is over. He suffered a dislocated elbow. Heard about the dislocated shoulders. I've heard about some dislocated fingers. How do you dislocate an elbow?
Yeah, so usually you're falling almost kind of backward to stick your arms out behind you to brace yourself. And it's just you get your arm and your elbow in the perfectly wrong spot with a certain twist, a certain angle, and the funny bone pops out. Fortunately, a lot of those injuries can be treated well without surgery. Not all the time, of course, but, fortunately, that's not always dooms you to an operation to rehab and recover.
What is it with different dislocations and, what exactly they mean for your body? When I ask that, sometimes you see a fighter in MMA or something where it's oh, this popped out and they popped it back in and you just kept going, right? And then other times, we see Chris Godwin with his dislocated ankle. We see this injury where they're season ending for guys.
Yeah, it's a great question. Every joint is just so different. For example, like shoulders, right? Especially with football, dislocated shoulders we know are a thing. A lot of those, especially in our football guys and contact athletes, a lot of those can actually end up in surgery in terms of trying to make sure it doesn't happen again. That's just the shape of the joint. The joint doesn't get a lot of help with its own shape. It relies on the soft tissue injuries. Sometimes for the elbow, the bone shape actually helps keep it stable. So sometimes some of the other connective tissue injuries or tendon injuries or ligament injuries, sometimes they're not as critical. So just all depends on what we're talking about.
I knew when he was asking it, doctor, it was a great question. I knew it. I knew he was going to get one out of you. I knew it. I felt it. What are the most common dislocations that you see? Is it the finger?
Actually, shoulder, honestly. Just because I see a lot of athletes. Yeah, so the shoulder is probably the most common we see.
All right, the Giants, like Aaron was just saying, placed Dexter Lawrence on season-ending IR with that elbow injury. Is that the kind of thing, we see it with a lot of injuries where they can linger and they can come back? Is a dislocation something that usually once you heal from it, you're pretty good, or is it one of those injuries that you kind of see a lot of re-injuries with?
Yeah, fortunately, elbow is one of those where hopefully this is a one and done. Sometimes, for example, as you guys were saying, finger injuries. Anybody who's had a dislocated finger or a finger injury is probably down for the count, right? You guys would know that. So, so fortunately, hopefully this is just a one and done for him.
They're very tough. They're very tough injuries.
Very tough. Yeah.
Baker Mayfield, this was interesting, Dr. Kumar. When he got stepped on, he said he could hear something. It sounded like there was a pop, and he thought it was an Achilles. And I'm guessing just from hearing over the years from what he's heard, Aaron Rodgers, Kirk Cousins, what that feeling is like. So what do you think the thought process was there for Baker when he went through that?
Well, I'll tell you what, anybody who's listening who's torn an Achilles can tell you that the first thing they say is, oh, man, I was playing basketball and I felt like somebody kicked me. And the back of my heel, and I turned around. There was no one behind me. And when we hear that, our ears perk up. We get a little worried about it. So that's a pretty common thing to hear. Fortunately, obviously, nothing of the case. So hopefully it comes out firing this weekend.
Yeah, no doubt about it. And we were wondering if that's something that you can see when you're watching an injury on the field. We've seen it with Aaron Rodgers and with Kirk Cousins last year. What about that injury is it that it is something that you see? Because most injuries that we see, right, a guy goes down with an ACL, we can't tell what it is on the field.
Yeah.
What is it about what's happening within that Achilles that it's that visual that we can actually see it on camera?
Yeah, the Aaron Rodgers video from last year was crazy. I mean, we could just see it snap and that calf muscle tighten up. I mean, to be honest with you, sometimes that's even tough to see just because action happens so fast and you don't get the perfect view of it. But a lot of times, like I said, if one of your buddies calls you and says, hey, they were playing ball and they just felt like they got kicked in the back of their heel or somebody stepped on them in the back and there was no one around them, that's sometimes a bad sign.
Taysom Hill, he's done for the season with a knee injury, tore that ACL. I just want to ask this about the ACL surgeries. Constantly with technology, there's always evolution in medicine and science. How have the advancements with the ACL surgeries, how have they changed and really grown over the years to where we are now?
Really, the big thing is, I think, after surgery. It's not just surgical technique. We've got a bunch of new technology on how we fix them, minimally invasive, but it's really afterwards, right? It's the rehab that we know is so critical to get an athlete back on the field quickly and safely. So that's where the, teamwork between the surgeon, the doctor, and the PT team, so critical, that communication to get them into PT quickly and making sure they stay on schedule. That's really where a lot of the advancements have come to try to get our athletes back healthy.
Dr. Kumar, is there something that's next? Is there a technology that's like coming along, an injury that we all kind of deal with and have that like we're on the brink of changing the way it's dealt with and how we recover from it, the way that ACLs have?
Yeah, I mean, to be honest with you, I'll stick with the ACL. One of the new things that have kind of come around in terms of interest is ACL repair and using some new biologic technology about trying to see if we can heal an ACL instead of having to kind of borrow parts, so to speak, Rob here to pay Paul, which is, the normal technique now. We'll see how that pans out if that does. And it has really good, results and can save even joints from kind of long-term wear. That could be a big game changer. So, that's something that, we'll see here the next, hopefully 5 to 10 years of how that pans out.
Everybody knows you robbed Paul to save Peter, not the other way around. That's how it goes.
Yeah, true. Yeah, sorry, my bad.
Dr. Kumar, always great stuff. The Pat and Aaron Show Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, where Pat will once a week ask a great question. They provide you access to one of the top orthopedic programs in the nation. Schedule that appointment today at floridaortho.com. Dr. Kumar, thank you so much.
Thanks, Dr. Kumar.
Hey, have a good morning, guys.